The effects of meditation and breath awareness on the brain and body. Hello, I'm Jim Morningstar, Director of the School of Integrative Psychology and the Transformations Breathwork Training Program. This presentation will give you an informed approach to using meditation and breath awareness to improve your health and well-being through understanding their effects on the brain and body and translating this understanding into effective life practices. Meditation and the brain research has been accumulating steadily for a number of years now, with new studies coming out frequently to illustrate some new benefit of meditation, or rather some ancient benefit that is just now being confirmed with fMRI or EEG. The practice appears to have an amazing variety of neurological benefits, from changes in gray matter volume to reduced activity in the me centers of the brain to enhanced connectivity between brain regions. I will share some of the most exciting studies to come out in the last few years and show that meditation really does produce measurable changes in our most important organ. Skeptics, of course, may ask, what good are a few brain changes if the psychological effects aren't simultaneously being illustrated? Luckily, there's good evidence for these as well, with studies reporting that meditation helps relieve our subjective levels of anxiety and depression and improve attention, concentration, and overall psychological well-being. This points to the brain being analogous to the hardware of the human body, whereas the mind reflects the functions of human beings or their software. Unlike the computer analogy, however, is the fact that the mind can actually change the brain's structure in a mutually reinforcing feedback loop, either positively or negatively. The mind is our set of cognitive faculties, including consciousness, perception, thinking, judgment, language, and memory. It can be defined as the faculty of an entity's thoughts and consciousness. It holds the power of imagination, recognition, and appreciation, and is responsible for processing feelings and emotions, resulting in attitudes and actions. Meditation helps preserve the aging brain. People who practice meditation develop more folds or greater gyrification in the outer layers of the brain, a trait that's highly correlated with intelligence across species. More folds help the brain process information, in part by providing more surface area to neurons with the same skull volume. Aging flattens these folds, but meditation slows this process, and the extent of the brain folding increases the longer you practice. Meditation also thickens areas of the cortex and insula, regions associated with complex thought, bodily awareness, concentration, and problem solving that also typically thin with age. A study from UCLA found that long-term meditators had better preserved brains than non-meditators as they aged. Participants who'd been meditating for an average of 20 years had more gray matter volume throughout their brain. Although older meditators still had some volume loss compared to younger meditators, it wasn't as pronounced as the non-meditators. We expected rather small and distinct effects located in some regions that had previously been associated with meditating, said study author Florian Kurth. Instead, what we actually observed was a widespread effect of meditation that encompassed regions throughout the entire brain. Meditation reduces activity in the brain's me center. One of the most interesting studies in the last few years, carried out at Yale University, found that mindfulness meditation decreases activity in the default mode network, the brain network responsible for mind wandering and self-referential thoughts, also known as the monkey mind. The default mode network is on or active when we're not thinking about anything in particular, when our minds are just wandering from thought to thought. Since mind wandering is typically associated with being less happy, ruminating, and worrying about the past and future, it's the goal of many people to dial it down. Several studies have shown that meditation, through its quieting effect on the default mode network, appears to do just this. And even when the mind does start to wander, because of the new connections that form, meditators are better at snapping back out of it. Its effects rival antidepressants for depression and anxiety. A review study at Johns Hopkins looked at the relationship between mindfulness meditation and its ability to reduce symptoms of depression, anxiety, and pain. Researcher Madhav Goyal and his team found that the effect size of meditation was moderate at 0.3. If this sounds low, keep in mind that the effect size for antidepressants is also 0.3, which makes the effect of meditation sound pretty good. Meditation is, after all, an active form of brain training. A lot of people have this idea that meditation means sitting down and doing nothing, says Goyal. But that's not true. Meditation is an active training of the mind to increase awareness, and different meditation programs approach this in different ways. Meditation isn't a magic bullet for depression, as no treatment is, but it's one of the tools that may help manage symptoms. Meditation may lead to volume changes in key areas of the brain. In 2011, Sarah Lazar and her team at Harvard found that mindfulness meditation can actually change the structure of the brain. 8 weeks of mindfulness-based stress reduction was found to increase cortical thickness in the hippocampus, which governs learning and memory, and in certain areas of the brain that play roles in emotion regulation and self-referential processing. There were also decreases in brain cell volume in the amygdala, which is responsible for fear, anxiety, and stress. And these changes matched the participants' self-reports of their stress levels, indicating that meditation not only changes the brain, but it changes our subjective perception and feelings as well. In fact, a follow-up study by Lazar's team found that after meditation training, changes in brain areas linked to mood and arousal were also linked to improvements in how participants said they felt, that is, their psychological well-being. So for anyone who says that activated blobs in the brain don't necessarily mean anything, our subjective experience, improved mood and well-being, does indeed seem to be shifted through meditation as well. Recent research from Emory University gives a more nuanced understanding of the relationship between meditation practice, amygdala activity, and overall mental health. The trial found that adults who practiced mindfulness meditation, the type that promotes heightened awareness and non-judgment, had reduced amygdala activity as compared to controls when exposed to images that were either positive, neutral, or emotionally negative in tone. This finding supports the notion that meditation enhances emotional stability by downregulating the amygdala. What's surprising are the results from a second group in the study who practiced compassion meditation, in which they learned to turn negative emotions and thoughts into positive ones with the goal of alleviating suffering for yourself and others. These individuals had also reduced amygdala activity in response to positive and neutral images, but heightened activity upon viewing images of human suffering, presumably because they had become more attuned to others' needs through their compassion training. Importantly, despite an uptick in the amygdala activity showing they were highly attentive to images of human suffering, the compassionate meditators had lower depression scores after viewing the images. This finding suggests that increased compassion towards others may increase your sense of well-being, even in the presence of strong and possibly negative emotional responses. Just a few days of training improves concentration and attention. Having problems concentrating isn't just a kid thing. It affects millions of grown-ups as well, with an ADD diagnosis or not. Interestingly, but not surprisingly, one of the central benefits of meditation is that it improves attention and concentration. One recent study found that just a couple of weeks of meditation training helped people's focus and memory during the verbal reasoning section of the GRE. In fact, the increase in score was equivalent to 16 percentile points, which is nothing to sneeze at. Since the strong focus of attention on an object, idea, or activity is one of the central aims of meditation, it's not so surprising that meditation should help people's cognitive skills on the job, too. But it's nice to have science confirm it. And everyone can use a little extra assistance on standardized tests. Meditation reduces anxiety, including social anxiety. A lot of people start meditating for its benefits in stress reduction, and there's a lot of good evidence to support this rationale. There's a whole newer subgenre of meditation, mentioned earlier, called mindfulness-based stress reduction, developed by Jon Kabat-Zinn at the University of Massachusetts Center for Mindfulness. It is now available all over the country. That aims to reduce a person's stress level, physically and mentally. Studies have shown its benefits in reducing anxiety, even years after the initial 8-week course. Research has also shown that mindfulness meditation, in contrast to attending to the breath only, can reduce anxiety, and that these changes seem to be mediated through the brain's regions associated with those self-referential, me-centered thoughts. Mindfulness meditation has also been shown to help people with social anxiety disorder. A Stanford University team found that the mindfulness-based stress reduction brought about changes in brain regions involved in attention as well as relief from symptoms of social anxiety. Short meditation breaks can help kids in school. For developing brains, meditation has much as, or perhaps even more promise than it has for adults. There has been increasing interest from educators and researchers in bringing meditation and yoga to school kids who are dealing with the usual stressors inside school and often additional stress and trauma outside school. Some schools have started implementing meditation into their daily schedules, and with good effect. One district in San Francisco started a twice-daily meditation program in some of its high-risk schools and saw suspensions decrease and GPAs and attendance increase. Studies have confirmed the cognitive and emotional benefits of meditation for school children, but more work will probably need to be done before it gets widespread acceptance. The dark night phenomenon of meditation. Some researchers have cautioned that meditation can lead to ill effects under certain circumstances, known as the, quotes, dark night phenomenon. But for most people, especially if you have a good teacher, meditation is beneficial rather than harmful. If the research is right, just a few minutes of meditation may make a big difference. But people with depression or past experiences of trauma, for example, may find themselves feeling increasingly anxious during meditation, no matter how much they try to focus on the moment. Or they may be plagued with intrusive thoughts, feelings, and images of the past during their mindfulness exercises. That's why the University of Washington researcher Sarah Bowen suggests that people with depression or trauma issues who want to benefit from meditation should try with expert guidance. If you get stuck in ruts like rumination, there are always ways to work with that, she says. It's important to have teachers who are familiar with meditation to guide you as you're learning. Experts can let people know what to expect and offer emotional support to help them through rough patches. Overwhelming anxiety, fear, and emotional pain, sometimes including symptoms severe enough to merit psychiatric diagnosis, are actually classic stages of meditation that Eastern practitioners are familiar with. But Western doctors and researchers who co-opted the practice and began advocating meditative techniques to treat mental illness were not studying them. They saw only the calming ability of meditation to focus the mind. Bessel van der Kolk, a leading researcher in trauma recovery, does not recommend meditation for his trauma patients, but finds yogic asanas a better way to help his patients become more safe and secure in their bodies. The role of the vagus nerve as a link between brain and body. Dr. Stephen Porges, originator of the polyvagal theory, has this to share, which is relevant to our use of breath awareness and meditation. The vagus is a cranial nerve that exits from the brainstem and goes to many, many organs of our body. Think of it as a conduit, a cable that connects our body with the brain. The vagus is really the largest nerve that travels throughout the body, and about 80% of its fibers are sensory. It's the portal to the brain from the periphery, and it tells our brain the state of our body. The vagus also has a whole series of other fibers. Some of them are myelinated, which means they are very effective in communicating, and some are unmyelinated, and they regulate organs that are both above our diaphragm and below our diaphragm. Polyvagal theory is relatively new and very important when it comes to thinking about body-mind interface and how breathing and meditation affects our physical and emotional states. The vagus is a very critical nerve that deals with all or most of our primary internal organs, and it communicates to the brain their status. When you feel good, your vagus is telling your brain that it's in a good state. When you're not feeling good or you're feeling nauseous, it's conveying that information as well. Mammals have a uniquely mammalian vagal pathway, and that vagal pathway is myelinated and goes to the heart and bronchi, the organs above the diaphragm. It is linked to the nerves that regulate the striated muscles of the face and head. Facial expression literally becomes a portal that tells you exactly how the vagus is influencing your heart and bronchi. When people are stressed out, how do they look? The window to our autonomic state becomes our face. We functionally have 3 autonomic nervous systems or circuits that follow a phylogenetic or evolutionary history, and these circuits provide a response hierarchy. When we're challenged, we use new mammalian circuits, the first in the hierarchy. And when they don't help us to get into safe and appropriate situations, we regress, use older and older circuits. Our newest, uniquely mammalian circuit is that face-heart connection, and we use this to literally convey to others that we're safe to come close to. When people convey to us that they're safe, we feel comfortable. However, when we are challenged, which can be due to normal life demands or threat, we can mobilize. To mobilize, we need our sympathetic nervous system, the second in the hierarchy. And we have to turn off the social engagement pathway of the vagus, which is a calming circuit. But fight-flight does not always work for us. And this is the whole story underlying trauma. Trauma is normally associated with unsuccessful attempts to get away. We resort to our most primitive neural circuit, and that functionally is a shutdown circuit, the third in the hierarchy, again parasympathetic. That shutdown circuit is also vagal, but it's the old vagus. It's the vagus that we share with reptiles like turtles. When this circuit goes, we just reduce our cardiac output and reduce our mobilization. That's associated with dissociative states and hypoxia. So the 3 types of vagal responses are the social communicative, the mobilization, and the immobilization. What control do we have over these responses? We can, in a sense, functionally change our breathing. We can change the motor tone to our face. We can control what is coming out of our mouth or going into it. And these can impact on our autonomic state. Of course, we know this in terms of what we might call just coping strategies. Even the acoustic environment, what we listen to, can impact through neural regulation of our middle ear muscles and can change our physiological state. People have always known that with chanting, with mother's lullabies, with motherese speaking, and even with normal engagement behaviors amongst friends. Voice is important. It's not simply autonomic, meaning automatic. It's really a hybrid system that, as we get more and more mammalian, we're using more and more voluntary or higher brain structures to choreograph how our visceral system works. Our nervous system evolved to pick up certain features in the environment. There are certain features, whether they're acoustic features or proximal features of gesture. Our nervous system is doing an interpretation of these features. Now, a lot of this interpretation is not on the level of cognitive awareness, so the word perception doesn't really fit well. The term coined by Stephen Porges for this level of interpretation is neuroception. This basically means the nervous system is evaluating risk, and when it evaluates risk, it tries to negotiate or navigate or trigger a neural component that fits the environmental context for that risk factor. If you hear or you're near a person who is engaging, smiling, articulating, and using prosody in voice, the rhythmic intonation of voice, then suddenly you start feeling very comfortable. You realize that background sounds disappear, you get interested, you get calm, and that's the social engagement system, triggering through features of safety. Now, if you engage a person and they speak with very short phrases, and their voice is not prosodic, talking fast and choppy, suddenly your nervous system will react to that. This is neuroception. And you try to distance yourself because you're now conveying cues to you about the body that they're not safe. When our nervous system evaluates that, we develop our personal narrative. We start describing or creating our own story. Our story has to fit, although sometimes it's totally irrational. I like this person. I don't like this person. This person treats me poorly. I don't like going to shopping malls. What we have to realize is that when people get triggered into either mobilization defenses or shutting down, they're going to develop elaborate narratives to make sense of what their body is doing. Suddenly you feel extraordinarily irritable. Do you want to blame others? Do you want to try to navigate your complex world? When our nervous system fails us, we use behavior. Like with the child going into a temper tantrum, they act it out. That's really when their nervous system of regulation has failed them, and we now use some behavior to dissipate the tension. But in a more mature person, at least we hope, is informed by an understanding of these systems, and you can think and navigate and move the body into a less demanding situation. We have to separate the vagus into two vagal pathways. The second one, that is really a defensive system, either mobilization for fight or flight, or as a last resort for shutting down or freezing. The first level of response is the supradiaphragmatic, meaning above the diaphragm, regulating the heart and the bronchi part of the lungs. That is linked to the facial muscles that become part of the social engagement system. This vagus is the calming system. This is the system that helps down-regulate defensive behaviors and defensive physiological systems. As long as we keep the social engagement system functioning, the older two systems are in homeostatic balance. Now, once we understand that, then the polyvagal theory becomes a profound window or portal to understanding the clinical symptoms and devising interventional strategies. That is, we can use therapeutic breathwork modulation, both slower and faster than normal breathing, and meditation to directly regulate our nervous system. Meditation and breath awareness. Awakening is the aim for most meditators, and it should be. The peace and joy that we get glimpses of in meditation can become much more stable once we get to the point where we can choose the mental and emotional states in which we wish to dwell. The choice is ours, and for many it starts with the breath. Continual breath awareness is just as it seems. It's being aware of the breath continually, all the time, from the moment you awake to the time you fall asleep at night. It is meant to be practiced while you're eating, cleaning, working, playing, driving, talking, and especially when you're in formal meditation. Breath awareness is the full-time meditation practice for those wishing to awaken and no longer use the excuse for not practicing, such as, I don't have the time. Most of us should be familiar with breath awareness if we have been doing any practice or study of meditation. Breath awareness occurs when we attempt to focus our attention on the breath, our breathing as it comes into the body and as it leaves the body. By doing this, the mind is given something to concentrate on, and we are then immediately brought into a state of presence if the practice is done correctly. By consciously engaging in any activity and by drawing our attention single-pointedly to this activity, we are placing that activity into the number one spot of our awareness and temporarily making it top priority in our field of awareness. Our senses are engaged, and for the time being, we are totally into it, whatever it might be. Now, by reflecting afterwards on what happened to our mind during this moment of focused and directed concentration, we'd find that we were momentarily in a state of mental peace. For the brief moment we were totally engaged with this activity, we were mentally free from any discursive or negative thoughts or feelings, and our emotions were likely in a neutral state as well. Through the practice of meditation, we come to realize that this happens with an allowing of the true nature of the mind to shine through. This is one of the reasons meditation can be so joyful. But it's not always easy to notice that we are mentally free from our negative mind states, because the noticing cannot happen during the actual time we are concentrated, only afterwards. Breath awareness is done when we are using the breath as our meditation object. That is to say, when we use the breath for our point of concentration. The breath is by far the most common meditation object, and rightly so, because it's always with us. We can have nothing in this world and still own the most useful meditation tool known to humans, the breath. Breath is the rainbow bridge from the realms of the physical to the spiritual. In many languages, the word for breath and spirit are the same. Typically, we may use the breath during our meditation practice, and once we're finished with the practice, we discard the breath and go about our day, never giving our friend the breath another thought, until we're either back in meditation or having some difficulty breathing for some reason. So what can continual breath awareness do? When we become concentrated, the problems in life temporarily disappear. They leave our mind and are replaced by whatever we are concentrated on. Like a child that falls to the ground. They begin to cry. Mommy kisses the boo-boo, and the child is instantly and miraculously healed and happily runs off to play. The attention was simply removed and replaced with a different kind of awareness. With continual breath awareness, we're bringing our attention within. Everything we experience is taken in through the body. When we connect with the breath, we're connecting with everything. We are mind and body, and the breath is a connection between the mind, the mental, and the body, the physical. When the mind and body connect, we connect with everything in our world. Furthermore, to have one reliable object, such as the breath, to place our concentration on is most valuable. The breath becomes our flagpole in the hurricane of life. It is something to hang on to and something to keep coming back to when needed. Continual breath awareness allows us to control the many thousands of needless thoughts we have each day by grounding our awareness. We can still notice the thoughts, but this noticing is different than the actual thinking of the thoughts. With continual breath awareness, there's no zoning out as with dullness, and there's no being carried away with the thinking mind, and so we can still easily function in the world. In fact, with continual breath awareness, you can function in the world much better. With the mindfulness and awareness that's brought about by continual breath awareness, we have the freedom to investigate thoughts without judgment, and whenever we choose to in our world. We literally create new neural pathways, influence the hierarchies of response in our brain, and strengthen our social engagement, become more compassionate, and prepare our brains to serve us in a longer, healthier life. Ultimately, by practicing continual breath awareness, we become happier. To be liberated is to have control of the mind, meaning that we can control the ability as to what thoughts we wish to think at any given moment. When we increase this area of awareness, we'll be continually aware of the fact that our joy and happiness is simply a choice. There's nothing out there that can make us unhappy. Our difficulties come from inside. The world does not have to be at peace with you, but you have to be at peace with the world. Remaining mindful of the breath throughout the day is synonymous with being mindful throughout the day. There's no difference. We are watching the breath, which is the connecting or pivotal point between the mind and body, the mental and the physical, and contained within the breath are many teachings. The first thing we notice in any meditation practice is that the mind is like a wild monkey out of control. We're trapped in the brain's me center. We then notice that the more we focus on this practice and tame the monkey mind, the less that the hindrances to our happiness are present. Continued practicing sitting meditation is the easiest way to build our relationship with the breath and keep it at its peak. Regular daily reminders of checking in with your breath reinforces your friendship with the spirit of breath. It's your best friend, and it will take you all the way.